important topic for the NCLEX because sometimes 10-15 questions only on this topic. Sometimes 2-3 questions, sometimes only 1 question, but minimum 1 is expected still, right? So we need to know. Now, these are the ethical terms which we need to follow being as a professional RN according to code of ethics, right? But if we are not following them, we are basically violating them in our profession, right? And definitely if you are violating, that will be like becoming on your license as well, right? So we need to know these ethical terms so we can follow them on the floor. Basically, what do you need to know them for the NCLEX? You need to know the meaning of them because they're going to give you an example in the question and they want to know from you what this example look like. A, B, C, D. Is this like related to accountability? Is this related to autonomy, beneficence, or nonmaleficence, right? Or they will give you example where the nurse, she's not following something, right? And she's violating about it. And they will ask you which of the following you are violating basically, as per the definition in the question, right? Again, options A, B, C, D, autonomy, beneficence, non-maleficence, justice, fidelity. All those options will be there, right? So let's talk about it. So the first one we have is the accountability. Now, if you're looking for proper definition, standard definition, everything is given in the Saunders book, like all the definitions. So I'm not going to say the definition to write it down right now, but if you want to write down some meanings in your words, feel free, make your own notes, right? So accountability meaning is what? Like being accountable for something, right? So there is a difference between responsibility and accountability because a lot of people, they're thinking this is responsibility. This is actually more than a responsibility. So let's say you are working as a nurse on the floor, right? And you're thinking I'm responsible for medication administration. Yes, that is a part of your duty because you're following it. But what is the difference now? What is accountability meaning is because if something happened to the patient after taking that particular medication, that means you are accountable for that. So accountability basically meaning is it's more than a responsibility. It's like you are accountable for everything around it, whatever you do with the client, right? That is the meaning of accountability. So you're taking that more than that responsibility for that particular situation, right? Another example, let's say, maybe you are helping a surgical client after being done through a surgery to go for bathing or something, right? Now you are accountable to make sure what position you need to do to transfer your client from bed to wheelchair or towards the bathroom, right? If you're not sure being as an RL and you're just doing it, that means you're violating your terms. Like you're not quite sure, but you are just being accountable for what you do, right? Or let's say you do something in a good manner. Maybe you made a good job. You know everything how to do it in that procedure. That means you're still meeting accountability. You're meeting accountability there. But if you're not meeting it, you're violating it actually, right? I hope you understand what is accountability meaning is, right? Another example, let's say as per the NCLEX, like as a common routine example. Let's say if I give you homework today to read an endocrine chapter, right? So you are accountable to read that because I told you to read that before you come for next class, right? If you're meeting it, your accountability is done, right? But if you're not meeting it because you thought you were busy at the work, right? That means you're violating those terms, right? That means you're not meeting them as a part of accountability of your role, right? So we need to be accountable for everything for our client when we providing them quality of care on the floor, right? Since the admission until the time of the discharge, whatever you do, you're accountable for that, being as an RN, right? I hope you understand the meaning of accountability. Anytime after watching these videos, if you have any questions still, you can always ask me a question so I can explain more in detail. The next one we have is the advocacy. Advocacy is like being an advocate nurse, right? I think I already discussed that one day previously, right? Like you're basically doing on behalf of the patient, right? Looking after the patient wishes on the behalf of your client. For example, your client is in pain and they're asking for pain med and you call the doctor on behalf of them. That means you're meeting your advocacy, right? But if you're not doing something, but the patient is looking, you try to ignore it, that means you're violating the term of advocacy. That's pretty simple, right? Next is autonomy. Being autonomous, right? This is we do in terms of with the patient, right? We let the patient to become autonomy, means independent, as much as we let them to be, right? So autonomy is more like is equal to, you can say, more as a making next person independent in something, right? So for example, one of your stroke patient have a paralysis on one side, and you let the person to hold the comb and everything, do the comb on one side, which is a good side, right? That means you're meeting autonomy with the person, right? But if you are doing everything and the patient want to involve, but you don't let the patient to be involved, that is you're violating it, right? So that is autonomy. The next one we're going to discuss together, beneficence and non-maleficence. Beneficence is like benefit, from the word benefit, right? Benefit is like you're benefiting someone, right? Benefiting someone. So how do I remember is the beneficence is, let's say I provide the benefit to someone. For example, one of my client was having a headache, and I just offered the person Tylenol, and the person says yes, and I give the Tylenol, and the headache goes away after that. The client says the medication was effective, right? That means I give the beneficence to the client. Or maybe I actually tell the person like, okay, I'll give you a call bell, right, within your reach. If you need me as a nurse, please push this button. Now, why did I do that? Because I don't want the patient to get a fall on the floor. That is a beneficence. You're benefiting your patient. So that is how you can remember the beneficence, right? The next one is the non-maleficence. Non-maleficence is basically meaning is no harm. Yeah, no harm. So no harm to your patient basically, right? Any situation where you are actually not harming your client. Benefiting, non-benefiting, that doesn't matter. But at the end of the day, whatever you do, you're not harming your client. That's why you did it, right? For example, let's say one of my client was about to fall, right? And I just saved the client somehow, in a last minute. I just put the bed in the lowest position. Maybe I put the fall mat or something under the floor so the patient does not fall. So whatever action I took it, I don't want the patient to get harm from there, right? That is something is the non-maleficence, right? Another example, let's say one of your client need an IV. You start the IV on one side, but that IV was not working good. And you thought it's better to start on the other side because you don't want the client to be in pain. So you took it out by yourself and tell the client it's better to have on the other, right? Why did you do that? Because you don't want the patient to be in pain, right? That's why you did it, right? So you have a reason behind not to being harmed. Or let's say one of your client have a penicillin medication order, right? And you're giving that penicillin medication, you're about to give it. But when you see the history, you see patient is allergic to that, right? And you're like, no, I don't want to give it. Let's call the doctor right away. You're preventing somebody harm again. That is the non-maleficence. I hope you understand the meaning, right? Excuse me. The next one we're going to discuss together is the justice and fidelity. Now, what is justice and what is fidelity? Justice means being fair, being fair, being fair with your clients. That is the justice, right? So let's say if you have 7 patients on the floor, you're being equally important to everyone. That is you're providing justice, being fair. It's not about like you're with someone for no reason and you're like, this is my favorite patient. No, right? That means you're violating justice then, right? So justice, simple meaning is being fair with your patients, with your clients, right? The next one we have is the fidelity, and I will also discuss veracity also at the same time actually. Fidelity and veracity. Fidelity is basically being loyal. Truth. It's not just a truth, sorry, it's more about like keeping your promise, being loyal, So not just a truth word, but you can say being loyal and promise with your client, keeping your promises. For example, if I'm telling the patient, I will be back in your room 5 minutes, and I just go back there in 5 minutes, that means I'm meeting fidelity, right? But I did not go back there for no reason. I was sitting free in the nursing station. I'm violating fidelity. But if you're busy in emergency, that's different situation. You can explain the client, right? So fidelity is more basically keeping your promises, being loyal to your patient, whatever you say. That's why it's very hard to keep the fidelity. And we always say, do not make the promises with your client until unless you're going to make it, right? Veracity, I want to discuss at the same time because it's pretty closer to fidelity. Fidelity is more like a loyal, keeping promises, but veracity is more like honesty, truth, being more honesty, truth, which means whatever you tell the patient, everything is truth, nothing false statement. For example, I'm about to do the IV line. So it's better to tell the patient there will be a little bit pain in your IV line when I will do the procedure, rather than you telling the patient, no, nothing gonna happen, give me your arm. No, that means you're violating veracity. I know we do a lot in Asian countries like that, but here we need to follow those rules definitely. So please always tell the truth to the patient. Even it's a small child. Tell the child. It will be like a small pinch, like a mosquito, when you're doing the vaccinations or something, right? So we always tell these things. So we don't basically tell them nothing gonna happen. No, and we never use those words there. Okay, so veracity is more like truth, being honest, right? The next one I'm going to discuss together is slander, libel, but along with that, we're going to discuss is defamation. So first, maybe write down defamation. Excuse me. Because slander, libel, they are the types of defamation. So defamation means defaming someone. Basically, you are kind of like blaming someone, making their reputation away, by false accusation. So that is defaming someone, right? Now, defamation, accusation can be done through different ways, either through written statement, either maybe you just say verbal, right? So that's why there is two types, slander and libel, right? So slander, S for slander, S for speak. That means whatever you do while talking, without written statement, but you just talk about the person. For example, maybe I just talk like, oh, this doctor came on the floor, but he did not call me. But actually, doctor called you. But you tell lie about the doctor to somebody else, Why you do that? Because you want the doctor to get defamed in that hospital in front of everybody, right? So that is basically, we call this the slander. So slander is, I try to defame someone individual on the floor. It could be your client also, but mostly we use the slander libel within the professions, right? Within the healthcare team. So maybe you do this by talking to someone as verbally, that is slander. But if you write it down about somebody as a false statement, that is we call libel, right? So let's say the same example, I talk about that same physician in a progress notes, nursing notes. But that actually does not happen. The doctor did not do it, but I just write it down about it. That is libel. Why did I do this? Because I want the doctor, to be accused by a lot of people on the floor, just to defame the person, right? So making like a false kind of statements to defame someone, that is we call defamation, and that can be done through as a slander or maybe as a libel. I hope you understand until now. The next one we have together is the horizontal violation and vertical violation. This is again do it together. Now, what is horizontal violation, vertical violation? Again, we usually use this in terms of healthcare professional, not with the client, because in this one we have to follow hierarchy. So let's say on the floor, as you know, there is a manager, right? If you have a manager maybe on the top of you, and then you are the charge nurse working there, you might have an LPN under you, And then you have a healthcare team also, right? So if this has happened between one hierarchy to another, maybe between RN to LPN or LPN to healthcare aide, or maybe between RN to healthcare aide, or maybe between you and the manager or LPN between the manager, right? So if it's happened between one hierarchy to another, this is we call is the vertical violation. Vertical violation. But if you do not do within the same hierarchy, you just do within the same profession, that is horizontal. Let's say between two RNs or between two LPNs. They have same experience on the floor, same risk and everything. Now, what they're doing between these two? What do I meant with that? I meant with that is basically you're trying to bullying someone, you're trying to talking badly with someone, fighting with someone for some reason. That is means you're violating your nursing boundaries, right? So whenever we do that, we call it violation, right? And maybe in short term, I would say lose your temper, being aggressive with someone, right? And you're doing because of, it could be multiple reasons behind it, but you're doing between the one hierarchy to another, that is your vertical. But if you're doing between the same designation, same profession, that means it's a horizontal violation. I hope you understand this one too. The next one we have together is the battery and assault. Battery and assault. Excuse me. Now, what is a battery and what is assault, right? Basically, whenever you threat somebody, right, that, okay, Mr. John, if you do not listen to me, I will poke you with an injection, right? We call it what? Assault. So basically, I try to threat somebody, but I did not touch the person. That is assault. No touching, but just threat. That is assault. But if you actually touch the person after threatening, that is bad. So for example, same example, if I touch the person's arm and I actually give the injection for no reason because the person did not listen to me, that is bad. And definitely we don't want that to be happen on the floor. They're the bad ones. False imprisonment, as the name already indicates, false in the wrong way. Imprisonment, you're keeping someone in there. So one of my diabetic patients want to go home. They have a right to make their own health decision. And I'm just keeping the person because I thought I want to keep it, right? That is false imprisonment. So this is pretty simple as compared to the others, right? Any questions until here?